We got a problem, folks. ADHD diagnoses are skyrocketing. More kids than ever are labeled, more adults are seeking help. And you know what that means? More pills. It's everywhere. From classrooms to boardrooms, people are popping pills for focus. But is it right? Are we overdiagnosing a problem that doesn't exist? Or are we finally addressing a silent epidemic? We're gonna dive deep into the world of ADHD meds. We'll uncover the truth, the good, the bad, and the ugly. So, what exactly is ADHD anyway? It's not just about kids bouncing off the walls. It's a real neurological condition. People with ADHD, their brains are wired differently. They struggle with focus, impulsivity, and hyperactivity. Imagine a Ferrari engine with bicycle brakes. That's ADHD. It's frustrating, it's exhausting, it's real. And it affects millions. They deserve understanding, not judgment. Now let's talk meds. The most common ones are stimulants like Adderall and Ritalin. They work by boosting certain chemicals in the brain. Dopamine, norepinephrine, these are your focus chemicals. They help you stay on track, get things done. For people with ADHD, these meds can be life-changing. They can finally sit still, concentrate, and reach their full potential. But there's a catch. These meds, they're powerful. And like any powerful tool, they can be misused. Section 4. The promise of pills, how ADHD meds help those who need them. For many with ADHD, medication is a lifeline, allowing them to focus and thrive. These medications, often stimulants like Adderall or Ritalin, work by increasing the levels of certain chemicals in the brain that help with attention and impulse control. This can make a world of difference for someone who has struggled with these issues their entire life. For folks with ADHD, these medications can be a game changer. They can help individuals stay on task, complete projects, and achieve goals that once seemed out of reach. The ability to focus can lead to better performance at work or school, and even improve relationships by reducing impulsive behaviors. Imagine struggling to read a page, your mind racing, unable to focus. This is a daily reality for many people with ADHD. The frustration and overwhelm can be debilitating, affecting every aspect of their lives. Simple tasks can feel insurmountable, and the constant mental noise can be exhausting. Then, imagine taking a medication that quiets the noise and lets you absorb the words. The relief can be immediate and profound. Suddenly, the world makes sense, and tasks that were once impossible become manageable. This newfound clarity can open up opportunities that were previously out of reach. That's the power of these drugs for those who truly need them. They can transform lives by providing the focus and calm needed to succeed. For students, this can mean better grades and a more enjoyable learning experience. For adults, it can mean improved job performance and more fulfilling personal relationships. They can level the playing field, unlock potential, and improve lives. By helping individuals manage their symptoms, these medications can enable them to reach their full potential. This can lead to a greater sense of accomplishment and well-being, and even improve family dynamics as the individual becomes more reliable and less impulsive. But it's not a magic solution. While these medications can be incredibly effective, they are not a cure for ADHD. They help manage the symptoms, but the underlying condition remains. It's important to have realistic expectations and understand that medication is just one tool in the toolbox. It's not a quick fix. Finding the right medication and dosage can take time, and there can be side effects to consider. Some people may experience insomnia, loss of appetite, or increased anxiety. It's important to work closely with a healthcare provider to find the best treatment plan. It's one part of a comprehensive treatment plan. In addition to medication, therapy, lifestyle changes, and support from family and friends are crucial. Cognitive behavioral therapy can help individuals develop coping strategies, while a healthy diet and regular exercise can improve overall well-being. With a holistic approach, individuals with ADHD can lead fulfilling and successful lives. Section 5. The Dark Side of Focus, ADHD meds and those without the diagnosis. Here's where things get dicey. The use of ADHD medications by individuals who don't have the diagnosis is becoming increasingly common. It's a trend that's raising eyebrows and concerns among medical professionals and educators alike. More and more people without ADHD are using these medications. They see them as a quick fix, a way to boost their focus and productivity. But what they don't realize is the potential harm they're doing to their bodies and minds. College students cramming for exams, professionals seeking an edge, the pressure to succeed is driving them to these drugs. They believe that these medications will give them the extra push they need to excel in their studies or careers. The reality is, the pressure to succeed is immense. In a world where competition is fierce and the stakes are high, it's no wonder that some people turn to these medications as a way to cope. But this is a dangerous path to tread. But here's the thing, taking these meds without ADHD is like putting a turbocharger on a perfectly good car. It might give you a temporary boost, but it's not designed for your engine. The long-term effects can be damaging. Sure, it might seem faster for a bit, you might feel like you're getting more done, but this is a false sense of productivity. The strain you're putting on your body and mind is not worth the temporary gains, but you're putting unnecessary strain on the engine. Your body and mind are not meant to handle this kind of artificial enhancement. The stress and pressure can lead to burnout, anxiety, and other serious health issues. You're risking dangerous side effects. It's a slippery slope. The potential for addiction, the risk of heart problems, and the impact on mental health are just a few of the dangers. It's important to understand that these medications are not a shortcut to success. They are a tool for those who truly need them, and using them without a diagnosis is playing with fire. Section 6. The Great Debate. Should non-ADHD individuals use these drugs? Now, some folks argue that adults should have the autonomy to choose what they put in their bodies. They say if it helps them focus and be more productive, who are we to judge? But hold on a minute, these aren't your average vitamins. We're talking about powerful psychoactive substances with real risks. We need to be careful. We need to have a serious conversation about ethics, responsibility, and the potential for abuse. Section 7. Finding the balance, responsible use, medical guidance, and open conversation. Look, there's no easy answer here. ADHD is a complex issue. It affects people in different ways, and what works for one person might not work for another. This is why it's so important to approach the topic with an open mind and a willingness to listen and learn from each other. Medications can be a valuable tool, but they're not for everyone. For some, medication can make a significant difference in managing symptoms and improving quality of life. However, it's crucial to remember that medication is just one part of a comprehensive treatment plan. Therapy, lifestyle changes, and support from family and friends also play vital roles in managing ADHD effectively. We need to stop the stigma. We need to encourage open and honest conversations about mental health. Too often people feel ashamed or embarrassed to talk about their struggles, which only makes things worse. By fostering a culture of understanding and acceptance, we can help those with ADHD feel more comfortable seeking the help they need. This means being supportive, non-judgmental, and willing to listen. We need to support research and find better ways to help those struggling with ADHD. Ongoing research is essential for developing new treatments and improving existing ones. By investing in scientific studies and clinical trials, we can gain a deeper understanding of ADHD and discover more effective ways to manage it. This includes exploring alternative therapies, new medications, and innovative approaches to care. And most importantly, we need to prioritize responsible use, medical guidance, and the well-being of all individuals. This means ensuring that medications are prescribed appropriately and used responsibly. It also means providing patients with the information and support they need to make informed decisions about their treatment. Medical professionals play a crucial role in this process, offering guidance and monitoring progress to ensure the best possible outcomes. This isn't just about ADHD, it's about the future of our health, our society, and our responsibility to each other. By working together, we can create a more inclusive and supportive environment for everyone. This involves not only addressing the needs of those with ADHD, but also promoting overall mental health and well-being. Let's commit to making a difference, one conversation at a time.